Thank you, Bishop.
Baba Trevor Shezi, thank you very much.
Sawubona webabshezi. Hawu. Ay cha usibambela official bakhulu. Webabu Trevor.
Baba Trevor Shezi.
Trevor Shezi. Webu Trevor.
Yeah, but this one.
Leadership.
My leadership.
Fonela master.
So Fonela is from yes.
Asuka macala.
Yes, khona abantu abangena namacala ku 2021.
Aya macala ngiyazi amacala.
Ay.
Shabalala. Dr. Letu Mashabani.
Hi, Bishop, I'm in now.
Thank you, Dokotela.
Siyabonga baba.
Sengithinta ke uDokotela icolleague yakho ubaba uDr. Shabalala. Baba Shabalala. Ngicabanga ukuthi mawusu ready wena. Okay, it's waiting for host to let you in. Ngizomtshela ke ithini
nayo isisi Bishop.
Siyabonga Mshengu Shabalala. Mase ngene wena. U driver omkhulu wale nqola. Yes baba, ngicabanga ukuthi asukudileka kakhulu Dokotela ngoba ngiyazi ukuthi kuningi enibheke ukuthi nikwenze njengamanje abefundisi bethu bayangena kakhulu for this particular meeting, and I must say Dokotela si run concurrently ne page la seThekwini senzela ukuthi abanye abangakwazanga ukungena la bakwazi ukuthi kodwa balalele. We're targeting region yethu kodwa we have extended also kubefundisi njengabasemgungundlovu, they are part of us. Ngibona nabanye futhi abase General Gizenga nabo bayangena, so ke ngicabanga ukuthi i-audience yethu will be broader. Noma i-meeting besimotivate no councillor uMpume Sithole okuyena orana i-Commission on Religious Affairs iCry yethu la eThekwini, kwaba ne-desire ukuthi ake sibe nale meeting nabefundisi sikumeme uzokhulumisana kanye nathi sithole i-direction yezinto ezithize njengesikhathi se-COVID. Ngizocela mhlambe yena ukhansela uMpume Sithole asho nje amazwi okusamukela, and then ngicabanga ukuthi ngizobe sengidlulisela kwena ke Dokotela.
Ngikhona njalo nami zwake lomkhulu ngibingelela.
Uhlalo wehlalo lo.
Yebo baba. Yes Bishop. Yebo baba.
Thank you, ma'am. Thank you very much Mthombeni. Ngiyocela ukuthi umeqeda comrade uMpume ngicela ukunikeza ithuba before sinikeze ubaba uMshengu.
Oh, ngiyabingelela. Ngiyabonga Dr. Dube. Fundisi.
Bishop Dube.
Uyazwakala?
Uyezwakala impela, uyezwakala sisi.
Okay. Angibonge Bishop Dube. Ngibingelele ene kubaholi bonke bezenkolo asebekhona ene ngaphakathi nabakwi page leli laseThekwini. Ngiyanibingelela nonke, siyanamukela kakhulu kulomhlangano wanamhlanje soba nawo la sizothola khona uDokotela wethu uDokotela uSandile Mshengu ophinde futhi ene abe uHOD wakwi Department of Health. Sizomthola yena ene ezosicacisela mhlawumbe ngeenkinga nje lezi ebesike sizixoxe kwi page lethu ethinta lesifo lesi esikhona i-corona or i-COVID-19. Siyabonga kakhulu ke Dr. Mshengu ukuthi baba kwi-busy schedule sakho uvume mangabe sicela sino-bishop ukuthi ake uze njengomhlali waseThekwini ke uzoxoxa nje nabafundisi nabaholi baseThekwini nabaholi bakwamanye ama-regions aduzane kwethu, ngoba abafundisi ngendlela ababaluleke ngayo bane-constituency enkulu abayiledayo and futhi ebalalelayo. So ukuxoxa kwethu nabo kuzosilekelela ekutheni izinto kade sizizwa esingelona iqiniso ukwazi ukuthi usixazululele zona zithi mangabe sebehamba sebeyokhuluma nabantu bakhulume into beyikhuluma from angle informed. So siyabonga kakhulu ukuthi ufike. Siyabonga futhi udokotela wethu omunye ebese size samco-opta even kuKra uDr. Zakhele Khumalo. Siyabonga yazi HOD uDr. Zakhele Khumalo hayi usilekelele kakhulu. Abafundisi bala eThekwini bake baba nama-campaigns abangene kuwona nje kuqala any campaign. I remember Mkhumbane they distributed 2,000 and more of ama-mask. Bawakhiphela abantu ukuthi abantu abafaka ama-mask bemise imoto. Yakhumbula uKra wonke wahlanganisa imali nawo wathenga ama-mask ukuthi nje bafisa ukuthi sibambisane nohulumeni ekwehliseni ukuhlaseleka kwabantu i-COVID-19. So siyabonga kakhulu bafundisi. Ngibonga nokuthi ngingenile nje. Siyabonga ukushiseleka kwenu ukwenza isiqiniseko sokuthi abantu enibaholayo bayaphila. Siyabonga kakhulu ke Dr. Shabalala, Dr. Khumalo. Siyabonga nje bafowethu nonke enike naba ne-role ekuthini ake kunqandeke lesi sifo. Dr. Bishop Dube, ngiyabonga mfowethu.
Thank you.
Bamukeleke bonke abaholi bonke, siyabonga kakhulu. Ake sibambisaneni, ngiyazi uma besebenzisana ndawonye singakwazi ukuthi sinqande lolu bhubhane lolu. Ngiyabonga kakhulu.
Thank you very much kuKhansela wethu waseThekwini uKhansela uMpume. Ngiyanamukela kakhulu nami babhishopi abefundisi ngizolo mhlambe ngesikhathi ngiphazamise ngoba mawusuku welcome amadoda amakhulu kufanele ngesikhathi uphazamiseke. Ngiyambona nobaba ophethe osiphathele iDamasa kubaleke kakhulu baba ukhulekani Mgungundlovu. Siyabonga kakhulu baba ubukhona bakho beingxenya le meeting. Ngaphambi koba baba uMshengu ngikunikeze ithuba ngicela ukuthi ngithathe leli thuba ngimemile ubaba uSiboniso Duma owuhlalo wozihlalo eShamthetho saKwaZulu Natal. Omunye kwabantu engicabanga ukuthi sisebenza kakhulu naye in terms of accountability. Ngizocela ukuthi naye asho nje amazwi welcome nokubaluleka ukuthi abefundisi babaluleke kanjani kulesikhathi esikusona njoba sibhekene neCovid-19. Into ebengingayifuni Khansela Sithole baba uMthombeni into ukuthi abefundisi babe confused kanye nabanye abantu abefundisi ba receive ama fake news bangazi ukuthi bazowahandlisha kanjani. Kungcono ke i-issue siyithole Mshengu from the horse's mouth ukuze usichazele wena isimo esenzekayo kwaZulu Natal mhlambe okugcina koba i-role yethu befundisi ecacile ukuthi what do we do in a situation like this. Kungabe ngathi siyayekelela siyabukela bese sibakha lobudlelwane beconsultation. Kungathi umfundisi mehlangana nenkinga esemgungundlovu angazi ukuthi kufanele asizakale kanjani, but we must be able to link with you and we must understand who are the people in the regions who need to assist us as you are an oversight. I mean, seeing all the province of KwaZulu Natal. Baba Mthombeni, can I give you an opportunity to say something before I hand over to Dongala Mavuso?
Angibonge kakhulu Nyamazane Nkosi, my bishop, ngokusinikeza this opportunity. Ngibingelele bonke abafundisi abakhona i-Fivefold Ministry, ukhansela uMondisi ugogo wami. Ngiyambingelela, ngifisa ukuthi ngimbingelela u-HOD. Ngifisa ukubingelela nawo bonke abantu abama-professionals eniba-invitile. I'm just going to tabulate ama-3 issues briefly kuwena Nzwakela. Ngiqale ngokuthi-ke ngibonge kakhulu-ke ngokuthi-ke ningaphezi njengebandla lase-ECC ukuthi njalo ningene esikhaleni nikwazi ukuthi nizi-address ama-imbalances azobe khona. Iphuzu lokuqala engifuna ukulisho, yesterday-ke ngikhuluma nje njengomhlali nami wase-South Africa Nzwakele, ngithe almost-ke yonke into esiyaziyo ekwi-physical realm has been tested, yakrashwa to the core. Njengamanje umuntu ozobe believele ekutheni yonke into ebonakalayo iyona abhitha ne-benchmark yempilo, lowo muntu vele uzosala enento eziningi ezi-outstanding. Lapho-ke ngibala in the process.
No, ungaqhubeka Mthombeni. Ngizomcela ubaba uShandu okuyena osendishaya ukuthi uma bengena abanye befundisa abafaka ku-mute. Ungaqhubeka baba. Umyothiwe ubaba Mthombeni. Xolani ngicela vula ubaba Mthombeni. Thank you.
Oh no, thank you so much Zwakele. Bengithi-ke zonke izinto ozibona on earth ziyi-manifestation eziqhamuka kwenye realm kaNkulunkulu. Kodwa-ke iqiniso ukuthi-ke njengamanje the dark forces are more stronger. So kungaba ingozi-ke nakhona ukuthi uma sikhuluma from a face value sicabanga ukuthi ngolwazi esinalo liyibandla kuzovele kubelwe into zizenzakalele. Likhona-ke le verse elikhuluma ukuthi kufanele ngabe siyinhloko asona umsila. Uma nje uzolikhuluma leyo bandla noma leyo verse ucabanga ukuthi ibandla automatically lizobuyela kwi-forefront, akubi kanjalo. Ibandla kufanele libe revolutionary conscious ukuthi on earth ikhona-ke equilibrium ekuyofanele i-achieve. Ibandla in the past kwi-ancient history ngesikhathi sama-emperors lawo 4 agqamile belisuke lizoba i-solution ngokuthi njengamanje ibandla of today in the 20th century bekufanele ngabe linama-immunologist, kufanele ngabe linama-virologist, so that ibandla lizokumele lifika uma kuthiwa yilona engabe liya-advisa kwi-council of the state noma kuthiwa libizwe government, lifike limnikeze i-solution e-scientific accompanied nanokuthi yini-ke yenzakalayo kwi-spiritual realm at a prophetic dimension level. Njengamanje ibandla linenkinga yokuthi ngikhuluma nge-body of Christ in this context, linenkinga yokuthi uma kumangala umhlaba nalo libe ingxenye yokumangala libe kwi-quagmire situation lihambe kwi-cumbersome mode njengawo wonke umuntu, okwenza ukuthi angabe salithatha-ke even ugovernment njenge-solution mesefuna iyisombululo. Angiye-ke partially ekhaveni isisombululo ukuthi kuyiqiniso-ke njengamanje ukuthi umhlaba wonke uface i-pandemic. Kuyiqiniso-ke futhi nakhona ukuthi ama-research nane-evidence ekhona azosiprovayidela into ey'hlukene. I-research uzongena kudokotela ozobe eqhamuka from i-level yaka-medicine. Kodwa iqiniso ukuthi by nature i-research inento-ke ozothi uma ufunda ngayo khona into ekuthiwa i-correlation ne-causation. Ihambe i-research nakhona ibe nama-contradiction. That is why ngithi international uzozwa ama-virologist azokutshela something else nama-immunologist kuze kufinyelele kwi-level ukuthi i-consensus ithi this strain siya-exista. I-consensus ithi siyaba-affecta abantu. I-consensus ithi at this point in time i-solution engcono yilezi zinto zoku-isolate-wa ukuthi uzame ukuzihlamba nazo zonke lezo zinto. So okwamanjena-ke uzobe soba nenkinga ukuthi ngoba vele i-west ne-east kwi-global setup kuyalwa, which ibandla kufanele ngabe liya-understand-ke nalo ukuthi ine-geopolitics akufanele-ke lona elitshela ibandla lizothula libe-isolated. Ikhona impi ekhona emhlabeni ye-America ne-China, and i-fundamental leyo mpi ikuyaziveza yazimanifest at some point in time sekubangwa i-space spectrum leli ozozwa phecelezi kukhulunywa ngendaba ye-5G advancement bebanga ukuthi oyongena kuqala uzoba ne-unfair advantage ey'ntweni ze-IT, uyoba ne-unfair advantage ey'ntweni ze-security of other countries. Angithi izwe nezwe line-jurisdiction, i-5G izokwazi uku-encroacha in other dimension yokucontrola space somhlaba. So uma sihlangene-ke nabaphathi beyimfihlakalo siyofisa ukuthi bathole ulwazi oluthe xaxa ukuthi kuyiqiniso lona ukuthi indlela esiyophuma ngayo kwi-quagmire situation ngabe ukuthi sazi kwelakamoya ukuthi kwenzakalani, then sihlanganise nolwazi olu-scientific ngoba nakhona ibandla iyonto elizoba i-solution ngayo ukuthi let us intertwine this. Uzokhuluma njengamanje udokotela, kodwa udokotela uzokhuluma nge-space of specialization sakhe, uzoshiya ukuthi ama-families uma seshonelwe noma sekwenzeka ezinye izinto, udokotela ka-specialize nge-after effect. Uspecialize ukuthi if abantu begula balashwa kanjani mase kuyadlula lapho. Kube sekungena-ke abafundisi noma i-interfaith in this regard. Ngiyavala-ke mfundisi ukuthi ngithe kwenye i-platform enamalungu esishayamthetho, ugovernment wase-South Africa kuyofanele angene asondele eduzane kwibandla ngoba njengamanje seninomthwalo ukuthi usuku nosuku niyafihla njengamanje. Akekho-ke umuntu obhekelela-ke the space ukuthi abafundisi abaphila kwi-context ye-reality yase-South Africa babhekelelwa ubani bona ngoba nabo bayadlula emhlabeni bedluliswa ile gciwane. So kwabona bazogcina besaba kodwa baphoqelekile phela ngoba yibona kufanele badlulise umzimba, yibona kufanele banxusele kuNkulunkulu. So sifisa ukuthi siyabonga nje abafundisi ukuthi bakhona basondele kodwa le process they understand ukuthi they must be in charge, then bafanele bakhambe ne-counsel e-correct ezosiza kuye phambili. Siyabonga kakhulu Bishop.
Thank you very much Baba Duma. Ngifuna ukuthi-ke sidedele ubaba uShabalala. uDr Shabalala uyena head of department weprovince yakithi KwaZulu Natal. Akabhekile nje iTheku, ubheke wonke ama regions noma ubheke iKwaZulu Natal yonke. Kodwa siyajabula nokubona abefundisi baseGauteng, umfundisi uMenzi nikhona nani. Now sifuna ukuthi asicacisele kabanzi ukuthi iprovince yethu KwaZulu Natal ibhekene nenkinga engakanani. Mhlambe ke sizoyixoxa le ukuthi isolution yethu iyini, mhlambe uyothi meseshile siplan meeting elandelayo ukuthi how are we going to approach government in terms of ukuthi sisizana kanjani. Let me take this opportunity, thank you Mthombeni, and give you Baba Dr Shabalala usinikeze i-background ongasinika yona noma statistics mhlambe ongasisiza ngawo, and then we take it from there. Imibuzo sizoyibuza ngasekugcineni uma ngabe eseqede ukusenzela i-presentation yethu, uzothi nje qaphu qaphu. Baba Shabalala, up to you. Dongala Mavuso.
Ngibonge Bishop, ngibingelele kuwena, ngibingelele ku Mthombeni usihlalo, ngibingelele kusisimphume Bishop usihlalo wami kwenye ama subcommittee engiseva kuwo la eThekwini.
Oh yeah.
Uphinda ngithethiseke kodwa ngiyazi namhlanje ngeke alithole ithuba kukhona abefundisa around me, so ngeke akwazi ukungithethisa. Mfundisi, the information engizoyishare i-information esinayo kwa health up to umhla ka-5 kuJanuary, and I will try to just be as wide as possible ngoba umfundisi uthi the people that are here are from eThekwini, but also there are people from other districts and there are people also on the social media. So ngizo involve everybody. Now, Mfundisi, on the 5th of January, ama numbers ethu KwaZulu Natal abantu aba infected by COVID-19 awu 216,568. Kulabantu aba 147,504 sebe-recoverile. According to us, this is 69% recovery. 69% osuwarishayo Mfundisi ngoba we are supposed to be higher than that. However, because of people's mobility, we are unable to say Usandile Shabalala, who was diagnosed 12 days ago, uma singamtholi we-address noma we-phone number asinike yona, we are unable to say Usandile has recovered or Usandile has died. So that is why we see ourselves with a low recovery rate. We remain, however, confident ukuthi the situation is not bad, because if you look at the number of people who have died in our province, from the very first time we had a case in KwaZulu-Natal, that is the 5th of March this year, sorry. No, 5th of March 2020. There are 4,805 people that have died. And that is 2% of the people who contracted this virus. Currently, there are 64,259 people who are active in terms of COVID-19. Now, that means there is 30% of people who are positive currently. Kulabo bantu 7% of the 64,000 now, 7%, which is 4,629, are admitted either in the private sector or in the public sector. So both the private and the public sector are sharing the 4,629. About 59,000 chose to isolate themselves. Ngiyafuna ukuthi ngicacise sisela. When you've isolated yourself, you are saying you can take care of yourself at home. You also are saying you have people who are taking care of you. But we still have responded to that by saying, let us have a guide esizoyinika abantu who are self-isolating, to say when you are at home and self-isolating, these are the things you should look at, and these are the medications that you can use, or these are the exercises or activities that you can do so that you survive until the 10 days when the virus should be out of your system and you start to live. We also have noted ukuthi the second wave has come, and it has come with a different version of the virus. This is the 501 V2 strain of the virus, which has shown us that some people who are positive with COVID-19 will now be, after the 10 days, having what we call the post-COVID effects. Omunye athi, everything is fine, but ngisakhathala. Omunye athi, everything is fine, but I'm still coughing. Omunye athi, I'm still fine, but after a few times or a few minutes in ngukuluma, my voice goes. These are all effects that we still are seeing of COVID-19. Therefore, abantu kufanele bazinakekele. But the other important part, eyenza ukuthi encourage people to seek assistance. Ukuthi we've seen people being diagnosed in a shortest period of time. Sizothi umuntu useshonile because they did not get oxygen. So we are encouraging people to check with their doctors how healthy they are, how fit they are, and then decide whether to be hospitalized or to self-isolate. Now, we also have seen, Mfundisi, ukuthi in this resurgence, in this second wave, the number of new cases are higher than the number of new cases we were getting in the first wave. In this new time, in this new second wave, we've seen a situation where On an average over a 7-day period, on an average per day, we get 4,485 cases. This is something new. We did not get this with the first wave. We've also seen there is what is called an average, and there is what is called a mean. But the important part, I think, is this average of saying, on an average per day, how many cases are we getting? The highest number we've received so far was 5,965, if not mistaken, but very close to 6,000 in one day. And this is the highest number we've had in the province. Before that, we were getting lower numbers. Sizoyixoxa kancane ukuthi i-behavior yethu as people, either believing ukuthi there is no COVID, or believing ukuthi i-mask ayingisizi, or when we're sitting in a restaurant, we do not use a mask, or when sitting at home among the relatives, we do not use the mask, or in a taxi, or even at work. All these precautions or lack thereof in terms of compliance to the precautions has made us experience these high numbers. So we are having that as a problem. I think I want to also go to what is called the incidence risk per 100,000. This is where we look at the risk of a person getting to be infected in a certain population. And we divided this according to the districts. The total or the general incidence risk per 100,000 in our province is 261 chances per 100,000. But at eThekwini, that number increases to 425. Uma uya eLembe, iwu 291. Umuye Mkungundlovu, iwu 217. Uma uya Othukela, iwu 123. Uma uya Ogwini, iwu 217. Uma uya Majuba, iwu 77. Uma uya Mkhanyakude, iwu 157. Uma uya eRigwala, iwu 160. Uma uya eZululand, it's 65, and Umzinyathi, it's at 59. So it shows that the incidence risk per 100,000 is very high in eThekwini. The reason for that is not that iTheku has high numbers of people, but it's because of the mobility of people in eThekwini. eThekwini, we get people who go to eThekwini because babuya beze ekhaya. We also get people abeze eThekwini because bazovakasha. We also get people abeze eThekwini because bazothenga bese behamba. That mobility makes this incidence risk ukuthi bephezulu. But the risk with that is that when these people then leave eThekwini, going to other districts, they may be living with the virus to those districts and increasing the incidence risk in those districts and increasing the number of people who are going to be infected in those districts. So behavior yethu is more important than what we call the pharmaceutical interventions, the medical or clinical interventions. The non-pharmaceutical interventions have to do with the behavior of the people in terms of wearing of the masks, keeping the social distance, adhering or complying with the regulations of the Disaster Act, and all the utterances that have been made by the President, by the Minister of Health and other ministers, by the Premier, by the MPLs within the province, and all the other relevant officials that are saying these are the correct things to do to prevent the spread of the virus, including ngoba ngikhuluma nabefundisi, avoiding ukuya enkonzweni, including ensuring ukuthi uma sisemngcwabeni, the period of time we take in that ceremony is 2 hours or less, and there are 50 people or less. Including ukuthi uma sishadisa noma sisemshadweni, the number of people should be as few as possible, and the number of hours we spend together should be as few as possible. So these are the things that we then are saying to relevant stakeholders, including abefundisi. Let us go out and preach to the communities to say the non-pharmaceutical interventions are not dependent on government, but are dependent firstly on the individual at home, on the family in their place, in the homestead, in the village, in the township, but also the activities within that local municipality become very important for us to say, are we meeting the government halfway, or we're letting the government run and then later say, government kamthombe niyahluleka. The other aspect I want to speak to, I'm not going to say how many cases are there in the district, per district. I want to just show the weekly comparisons of cases. I'm going to compare 3 weeks as of elandelana. The first week is the week of the 20th of December, engizoyiqhathanisa with the week of the 26th of December. Bese ngiqhathanisa the week of the 26th of December with the week of the 2nd of January. On the 20th of December, the total number of cases in our province was 157,432. But on the 26th of December, the number of cases was 180,250, an increase of 22,818. When you then compare the 26th of December and the 2nd of January, on the 26th of December, as I've said, the number was 180,250, but on the 2nd of January, the number is now 209,691, an increase of 29,441. A very big jump. So these numbers are not increasing because people are admitted or people are isolating, but they are increasing because people are behaving in a certain way that is saying they are not taking precautions. I'm not then going to go into the numbers per district, the new cases per district. Safe to say that on this day, the 5th, the number, just new cases, is the number that I already have alluded to. The number of beds available on the 5th, we were saying we've got in the public sector 3,657 beds available. We are trying to increase this number of beds all over the province. Ukuze abantu mabakufuna ba-admitwe, ba-admiteke. Angivezeke inkinga esibanayo enkulu iba ukuthi uSandile Shabalala athi kade ngifuna umbhede angiwutholi, ungakwazi ukungisiza? But uma usuthi ya no ngina umbhede eCloud athe awume kancane ngizobuya kuwena. In essence, our people are looking at beds in the private sector, and the private sector goes around to say, we don't have beds anymore. Bese umuntu othe usetshela ukuthi awukumbhede ku-private sector, abuye umeseza ngapha azothi babuduba ungikhulumele ngifuna ukungena enkosi. The problem is we're trying to reserve inkosi for cases that really specialize services, cases that need a bed and oxygen and CPAP and maybe simple ventilation. We want to distribute all over the province because we want to make sure that people get to be admitted according to the need. We have seen also in the private sector where a person will go in and a demand which no say high care and mamfage high care. They are making money, it's okay. But we can't put you in high care because you demand to be in high care. We put you in high care because your clinical condition calls for you to be in high care. These are the slight differences. I said the number is 3,657, but these numbers you may find Mfundi Suguti, Umang presenter next week, they will have changed drastically because I have asked the officials in the department to say in all the districts, let's increase the number of beds because we see most people who get to be infected need oxygen, and we also are increasing the number of available oxygen and oxygen points. That work is ongoing in the province as a whole. The other part that we then are saying is that these beds are divided into those beds that are for isolation and beds for the people we're saying they are persons under investigation. Then the people who need oxygen, ICU, ICAR, and all that. I'm not going to go into that. And Kabanguti, the important part is that we still have enough beds and the admissions are ongoing. Just to prove that, when we were preparing this presentation, for isolation, we had 2,043 beds, but of those, there were 971 that needed oxygen. And there were only 25 that needed to be ventilated. And 20 only needed to be in high care. So this is proof that while we continue to admit, we also are looking at where do we admit you, what services do we need. Ngicela ukudlula-ke Mfundisi endabeni yembhede ngikhulume into ezoveza a little bit of what are we doing. And ngikuveze mhlambe before that ukuthi we also have field hospitals where we can admit people and sit with them and be able to say, you are in a field hospital, if you need oxygen, you will get oxygen. So we're preparing Ipalomie to such that it's ready for all that. Having seen Leandengeng, I mentioned in the private sector and the public sector, we admit differently. We then formulated what we call a protocol steering committee, which is a multidisciplinary team. Ebuga uguti, when somebody is admitted, how are they taken care of in the private sector and in the public sector? But we also have employed more specialized nurses, and we continue to train our healthcare workers to ensure that they know how to do the test correctly, how to give you oxygen correctly, how to give you what we call CPAP now. And CPAP Mfundisi won't go very deep. CPAP merely means continuous positive airway pressure, which means umshini okusizayo ukuthi ngesikhathi uyiphefumulela, but there must be a continuous positive pressure in your lungs so that your lungs do not collapse and the oxygen exchange can easily happen. So we have our staff trained on that, and we're preparing more of those machines. In fact, the last time I checked, we had some sitting in Wentworth waiting to be distributed. But also, we are workshopping our doctors because we've seen that our doctors will speak to the physical aspect and angayinaki the psychological part very much because afuna the friendship, but also a little bit we find ukuthi the lack ebishiwo umthombeni of the other realm of the spiritual. Umungayinaki kwabanye abantu, they easily lose it and they think I am gone. So we're looking at treating the whole or the complete person instead of just treating the one part, although especially is the physical. We must take care of that, and we must really say, this is where we are trained. All the other parts we are supporting. We also are then increasing our capacity in terms of beds, in terms of skills, in terms of all the support that we need, including the ventilators. So that is work that is ongoing in the department and the government in general. The important part, which I want to emphasize, but also ask ubuholi esikhuluma nabo namhlanje ukuthi there is something called health promotion. Ngoba ipolitiki ke akuyona into yami. Njalo njoba ngila nje ku-HOD mina angiyazi enye into. Ikhona lento eyathi umuntu kufuneka depende kumlungu noma depende ekuthengeni to have some of the things. Uzwa abantu bethi ngiyagquma kodwa ukuze ngigqume kufanele ngiyothola i-eucalyptus. Kodwa ukugquma kahle kahle you are looking for the steam, kusho ukuthi you are looking for boiling water. Now eucalyptus mhlambe can have an effect, kodwa do you really need eucalyptus, or the mindset is telling you ukuthi hey laba bathi bafundile sebethe eucalyptus is the best thing. But all in essence was saying is prevention is better than cure. Therefore, if we can prevent these diseases, if we can do health promotion than health treatment, we can do much better. And we are then saying the responsibility of health promotion is isigiti sonke manje, wherever we are, about COVID-19. The emphasis on treatment and treatment adherence is important. The treatment adherence not for COVID, but also for other diseases that people may be having. People who have died from COVID-19 are people who have shown to have comorbidities. And therefore, those people must also be told to adhere to your BP treatment, adhere to your diabetes treatment, adhere to your cholesterol treatment, and then do anything else. COVID with this being controlled, chances are you still are going to survive. But the information and education and communication material that we then distribute, we will distribute it with social media, distribute it with billboards, distribute it with conventional media, but in some instances, uma kungena ucomrade noma gugu vele kuthiwe IOMC uzositshela lento yakhe, kodwa uma kukhuluma umfundisi balalela abantu.
Xolani, please, Dr. Shabalala is muted.
Okay, I'll advise him as well.
Okay, please. Dr. Shabalala, you are muted.
Oh, so we then are saying, Fundisi, it's important ukuthi all of us, we must ensure ukuthi we are stakeholders and partners in this thing of sharing information, of communication, of health promotion, of risk communication, and community engagement. So that is important for all of us, and we are really dependent on people other than Ukomrade Nomakuku, because People will listen to Umfundisi Dube. People will listen to Uduma uma efika ngasekhaya ethi no hayi bathombeni bayafa abantu uma senza kanje kusho ukuthi nathi sendleleni. People will listen to Usismpume uma ethi as a councillor, this is what I've seen and these are the issues. But also the business sector must also be a partner in this thing. Singakhombi government because we are the government in any case. We also are worried, Mfundisi, in the funerals, people will want to go and share the mic and bakhulume ngomuntu oshonile. It's okay, but let's still comply with the regulations. Areas where alcohol is sold, again, gives us problems. Areas where people go and dine and eat out, kuma restaurants, nama hotela, we do have problems. People where people are going either from home to work or to wherever, but in transit, either in taxis, in trains, or whichever mode of transport, we do get problems there as well. But we then are saying this risk communication and community engagement is for all of us. And can we then take that responsibility and make sure we partake in that and liaise with everybody? A comprehensive plan, Mfundisi, of the government will be coming, which will go as low as possible in terms of governance and leadership within our province. But it's a responsibility of everybody. We also are now having a rapid test, an antigen test, and Soyayo ET. We want to test a person and find the results as soon as possible. And when we found that, we then are able to say, you need to be in the isolation ward for COVID people, or you need to be in a general ward, or you even need to be discharged. So we have that, and we're trying to improve on making sure things are okay. I do appreciate some people will say, yes, there is no water, but there is a sanitizer. But also, if you are able to wash your hands, you do not need a lot of water. So we cannot say I did not wash hands because there was no water. Those issues are very critical. I think, Fundisi, I will not want to go deeper into all these things, except to go and say, there is now the 5G versus the COVID-19. When we discovered the COVID-19, we came to say this is a virus that has existed before, but in animals rather than in human beings. But just like the virus we got, Mfundisi, ngesikhathi kutholakala what was called SARS, Severe Acute Respiratory Syndrome virus. Ngesikhathi kutholakala the virus that was called MERS, which was Middle East Respiratory Syndrome virus. Ngesikhathi kutholakala HIV, the Human Immunodeficiency Virus Syndrome. Ngesikhathi 1918 kutholakala Spanish flu. You go back to, or if you read history, during the Stalin-Hitler time, there were some flus that came in there. There is even a London flu. There is also an Asian flu. Those were viruses. They were linked to no revolution in terms of the IT. Why are we linking this virus with the IT? But let us also take another spin. When we take Umfundisi and we say, let's do an X-ray, we are using X-rays, we are using rays even there. When we take you to a CT scan, we are using rays even there. When we take you to an MRI, we are using rays even there. When you've got cancer and we say we are doing radiotherapy, we are using rays even there. Why didn't we choose ukuthi lawa ma-rays aswafuni noma esilapha? But this time we are connecting the two rays and saying lawa ayasibulala, but there is no evidence that we are having. But Mthombeni did allude to the fact that there are different realms that people look at things. However, we then need to delve deep and look at where are we in terms of the left and the right and all the other aspects of the politics of the world relative to all these that are happening, including the issues of the vaccine. Vaccine in the province, and when the vaccine comes, the National Department of Health will guide us how it is going to be distributed, who are the first people to receive it, and how we are going to make sure people are not affected negatively. We, however, are challenged, I think, as a country to say our scientists themselves must do research and make sure when we come into any podia, we are talking of research that we can stand for, be it IT speaking or medical speaking, so that our people are confident. However, we must embrace a few things. There is a doctor in South Africa who says, I have done a bronchoscopy. He is less spoken about anywhere in the world, and he has written a paper. We have not spoken about him a lot, but the question is, why is it that we're not speaking about him? Is it the mindset? What is the problem? On the other hand, Mfundisi, there are those who are saying, let's go back to level 5 in terms of lockdown. During level 5, we did see gender-based violence. During level 5, we did see trauma. During level 5, we did see non-communicable diseases going up. So we are very careful about such decisions, but we then need to say the government doing all it is doing, where is the community in terms of coming to partner with the government? And then we say, how do we fight the scourge that is facing us together, government and the community? In any case, government is community now. Mfundisi, may I stop at that and we discuss.
Thank you very much. Thank you very much, Dr. Shabalala. Ngicabanga ukuthi usithathe through a lot of things. Njengoba ngisho ukuthi usinikeza ama-highlights. Mhlambe uma usuphendula imibuzo, you will touch base kule yama mortuaries, you know, because now it's also a very big a problem. Ama-mortuaries kahulumeni ukuthi are we still okay in terms of abantu abashonayo na ngoba sithola a lot of media, and mase sithola kwi-media sisuke singayitholi from horse's mouth manje iyethusa. I must also emphasize ukuthi kuthina befundisi, it gives a lot of pressure and strain uma abantu bethu bekhala besho izinto, and it becomes too much. I must add also ukuthi even nurses and doctors themselves, I've seen them needing us, njengabefundisi, that we need to minister to them, we need to pray for them. They want to give up, and they are honestly really not happy. That's why I was saying we need a very explicit role okufanele ukuthi sidlale nabefundisi. And I know that after this meeting, we are going to commit ourselves as what we are going to be doing together with you. Maybe last one, I will allow abefundisi. The emphasis, was there a need? You know, because we fight that all the time. How risky was it? Maybe if you would pass on that one. But Ngoba, we do have some leaders who are here even some leaders that are leading other fraternals like Bishop Mchunu, like Bishop Uzondi, like Bishop Udlomo and others. Ngicela ukuthi uma kukhona uma ungasiboni isandla lasiphakanyiswa khona ngicela nje uzi-unmute usho igama lakho sizonotha phansi mhlambe sithathe 1, 2 or 3 up to 5 questions esiwanikeza udokotela mhlambe nala sifuna asicacisele khona in terms of explaining some things that were not explainable. I know it's a short meeting, we are going to be finishing shortly, but we needed this meeting so that we are at least on par with the Department of Health of our province, KwaZulu-Natal. Anybody, any take question or explanation? Babu Clifford, thank you very much, man of God. We'll see you in Poston. Any question? Ungazi unmute ushi igama lakho and then bese we are ngiyabona Bishop Gumede. Bishop Gumede, I've seen you. You are number 1. Anybody else, wave your hand so that I can see you. All right.
We have Apostle Dlomo.
Apostle Dlomo, thank you very much. It's going to be Babu Kumete, Canon.
Pirikimana
Apostle Dlomo.
Matthias. Pirikimana Matthias.
Okay.
We've got Ubaba Usenzo Mieni.
All right, Pastor Matthias. Pastor Mieni.
Yes.
Right.
Pastor Como.
Okay, Pastor Como. All right. Maybe any last one? Ingabi mningi kakhulu. All right. Okay, Pastor Mapumulo. Can we end up there? See niggas input. Then sibwele back go to let me start with you, Canon Kumete.
Asibingelele ngiyazwakala.
Uyazwakala phakathwayo. Thank you.
Amen. No, ngiqale ngokubonga Bishop Dube inkulumo kababa wethu Mshengo HOD iyazwakala and iclear and imnandi, but thina njenge leadership I've got imbuzo ewu-2 noma owodwa.
Right.
Ukuthi ukhulume ngemikhuhlane evelayo eyayivela kulemanye amazwe. Thina la eThekwini esiqalayo neminye mhlambe ukuthi ngendlela esiqhamuka ngayo manje sikwazi ukumelana nayo. Umbuzo wami oqala ke nje uzothi Babu Dube ngoba lembuzo imibuzo eqhamukayo thina njengama leaders iqhamuka kubazalwane ukuthi how come sibona kwamanye amazwe beshisa lento ye 5G. That's one. Okwesibili, how come ukuthi leminye imikhuhlane eyayikhona ibe nawo ama-solution. So far lo okhona njengamanje bathi hlala ekhaya we-isolate and then uma usuxinekile udingeka ukuthi ufake i-oxygen and then ikuphi la kodwa eyenza khona mhlambe okuwusizo okutholayo noma okuwumuthi ophuzayo or mhlambe oyenzayo, because ngithe mangimuzwa ekhuluma ngokugquma ngamuzwa engazi ukuthi ubaba uShabalala akabi in details ukuthi ku right noma akukho right ukugquma. Mhlambe mase ngithola i-clarity nje lapho no ukugquma ku right, we can do it ngoba leyo yokubuka kuma social media akusilekeleli kakhulu. Sesifuna ukuzwa kuyena ke umphathi ukuthi yena njengomphathi uthini ngokugquma nangalezi zinto abayishoyo futhi sizidle ukuze ukwazi ukuthi sikwazi ukusilekelela empilweni. Ngiyabonga Baba Bishop.
Thank you very much, Canon. Apostle Dlomo.
Baba Bishop. Yebo Bishop. Angiqale ngithi Bishop kakhulu sibonge ukuthi uhost this informative session that is enlightening. Bese ngithi mhlambe ngibonge futhi kudokotela ukuthi asibeke nje emgqini. Mina okwami isicelo, Bishop. I am feeling that the government is very slow in communication. Things are coming from a source, and the government keeps quiet. And the situation is very explosive. So people get confused. We really feel that the government is very slow in communicating the truth. Ngafisa mina sicela ukuthi ubaba balala Mshengo asiphathele lokhu ukuthi ake kube ne deliberate nokuthi intentionality kukhulumeni to communicate radically to all the people, because already there is a situation about vaccine that is in the community. About all this, it's been very quiet. Let me take, for instance, this session that Bishop Dube has hosted. I can see we are very few, yet there's information that goes to thousands and thousands of leaders. So thank you very much, but we would love to share the campaign to communicate, because there is quite a vacuum and people are occupying that space. Thank you.
Thank you very much, Apostle. Pastor Matthias. Pastor Matthias.
Can you hear me?
Yes, yes, I can hear you now.
Okay.
Continue. Yes, sir.
Thank you. First of all, I just want to thank you for such an information a meeting. It's very informative. I would like to ask a question to Dr. Shabalala. If he have seen how the salon business work, if, for example, somebody want to fix his nails, how do they sit? And then he see how the church people sit with social distance. How or which science could have been used to ban the church to operate and allow a salon to operate? I don't see and I don't understand that science. That's one. Number two, when the minister was responding to this question, she was saying that the church must not operate, but that contradicted her initial statement when she was giving regulation. And if such communication breakdown or failure is not corrected, then the church will be much in confusion. That's my second question. The third and the last one, when they link 5G, and I could see yesterday that the mayor was defending that the 5G is not killing people. If in the future it will happen that it's not good for health, who will be responsible for such death? I'm just asking. Thanks.
Thank you very much, Pastor Matthias. Can we move to Pastor Senzo Mieni? Pastor Senzo Mieni, you are muted. Babu Shandu, can you unmute? Yes, you are on now, Babu Mieni. No, I was saying unmute.
Oh, okay.
Yes.
Okay. No, siyabonga kakhulu Bishop. I think my take actually ngikhavekile kancane laphana kubaba uDinangwe umekhuluma about the agency and you know, the response of the government. For me, I don't see that okay, well, let me really be fair and thank you, Bishop, for hosting this meeting. Thank you also to Dr. Shabalala for such an insightful input this afternoon. My worry is that we don't see that urgent response on the ground on the side of the government, the Department of Health. All that we see and hear is actually the National Command Council up there, you know, and perhaps the provincial government at some extent. But I think we should be seeing more of mobile clinics, you know, where we see government coming closer to people, bringing health services. For now, it's like business as usual. If you are sick, you go to the hospital, or you go to the clinic. And most of the time, you find those resources being overwhelmed, you see. So I really think that also in the delivery that the Honorable Doctor gave us, he was going to tell us in terms of the beds, to say that before you know, the first wave or before the second wave, these are the X number of beds that were available. And now that we are facing the second wave, these are the number of beds that have been added, you know, into the tally to actually assist, you know, in the demand of the beds. And it just seems to be very, you know, acceptable. The thing with ibhedlela zigcwele, you know, abantu abakwazi ukuthathwa because ibhedlela zigcwele. We have 3,000 beds in KZN. How many beds did we have before this COVID-19? That's the kind of report that we need, so that we can see the efforts of the government trying to meet the demand that is being created. I was talking to one of the ladies in Westville prison, and she was saying that, you know, like sort of like every day they are losing about 2 members, you know, and that is such, you know, a very concerning statistic. I think every way, you know, we can see that the statistic is rising. But what is the equal response that we are getting from our government? I believe that when this pandemic started, there was even a call that said that we should lock the country down and have no movement of people, so that we can also allow the government to create extra capacity to meet with this virus, especially when it comes to eThekwini. eThekwini has been earmarked, or has been identified as one of the hotspots, if not the hotspots right now, the epicenter of the pandemic. What are the you know, response measures that are being taken to show the seriousness of the virus? Because it seems that the only thing that we can do is just to shut down the churches, you know, put on our mask. But what is really happening, you know, from there? So maybe the other one that I wanted to ask, maybe this is directed to you, Bishop, and other leaders of the church that are here, to say that if we can allow funerals to host 50 people, we need to advocate for the church and say, at least if we've got less numbers, we need to allow the church to pray. Our government needs to take the church. It is our right that is enshrined by the Constitution to associate, to worship. But if we can prove as leaders that we can be able to do this in a manner that doesn't put people's lives at risk, we can do the sanitization, we can do the temperature scan, the keeping of registers, and all of that. Before I take all the time, you know, of the meeting, those are the 2 points that I would really like to hear, that if I converge intercessors at church and I pray with them, about 15 of them in our church hall, will I be arrested as a pastor, or will I be breaking the law? Or is there any other, you know, like just in that word of advice? If we are meeting as a church and we are under 50, am I breaking the law? Because, you know, one pastor can actually report and say, hey, Pastor Mian is meeting there. He's having a church, it's a Wednesday. And I say, no, but we are having prayer. And we are only 12 in this gathering. Is that gathering illegal? Thank you for allowing me to take so much time, Bishop.
Okay, yeah, welcome, Babumien. There is a saying, ethandwa ubaba uduma, you know, into zoyibosho, Babu Komo, Pastor Komo. We have two Komos here. Angazi noma besisho ubaba Komo noma uBishop Komo.
No, siyabonga kakhulu. Yes,
Thank you.
siyabonga kakhulu Bishop as a host. Nakubona bonke abakhona ikakhulukazi. Khabe nisho impela Bishop.
Yes, ungaqhubeka baba.
Imibuzo yami engihlose kathathu. Asibonga ku HOD ubaba uShabalala. Okokuqala nje ukuthi angazi isikhathi epresenter bengi esemgwaqweni kodwa umbuzo wami uthi nje shortly, why are we waiting indaba ye vaccine till April? Why are we waiting till April? Asizoyithola nisingena kulento eyayikhona ngama late 90s la kwakubangwa khona indaba yama ARVs ukuthi abantu bayafa ngapha kulokubangwa ngokwezepolitiki ukuthi yini ingavele ithathu ivaccine isebenze right now. Ngibuzela njengomuntu nje on the street ongayazi indaba zama science nokutestwa ukuthi why are we waiting till April? Number 2, sicela uyidepartment siyahlonipha idepartment yakwa health ikakhulukazi uminister ubaba uZweli Mkhize. Siyabonga kakhulu umsebenzi abawenzayo. Kodwa sicela ukuthi mhlambe before information bayidlulisele emphakathini bayihlolisise ngoba sizwe kuthiwa uma sengena isama leli gciwane lizokwehla kodwa kubonakala ngathi likhuphuka kakhulu. Manje we are confused with such information okusho ukuthi mhlambe ayingarisishwanga kahle le information. Lokho kwenza ukuthi abantu abaningi bagcina bengasayithembi information. Number 3, ukuthi si-check ukuthi i-department yakwa health njengabantu abadila nezempilo uke waliphatha leli gama ubaba Shabalala lodwa kwadlula kulona ukuthi uma ku-treat umuntu kufanele treatwe holistically ngokwezempilo emzimbeni ngakwezamoya futhi ukuthi okuyirole abefundisi ke leyo ukuthi sike senza i-drive through nabefundisi la eMgungundlovu 2 Sundays ago kwakuyi-drive through prayer. Asibangana nkinga esibhedlela esi-dominantly abamhlophe i-Grace Hospital sangena khona, but sibe nenkinga besingangena emahotini besi-driver around because we believe in the power of prayer. Si driver around isibhedlela. I can tell you ukuthi abantu abaphethe laphana they were very unreasonable. Ikakhulukazi no-daily sagcina singakwazanga at least ey'dindeni sagcina sikwazile ukumuva ukuthi i-role yethu njengama-frontline workers abefundisi esibhekele ezikamoya i-department yakwa health ingakwazi ukusisiza ukuthi sikwazi ukuthi ukudlala i-role yethu sikwazi ukuthi siwenze lo msebenzi ngaleko kuphazamiseka. Mhlambe okugcina ke nje ukuthi mhlambe njengoba singakwazi ukuhlangana njengamabandla asinayo imali yokuthenga ama-PPEs lawa akhava umzimba wonke, but siphoqelekile ukuthi semngcwabeni siyongcwaba umuntu noma kwazeka ukuthi lo muntu ube covid case. Ayikho indlela ukuthi department yakwa health isubsidize ukuthi siwathole lama PPEs because I'm sure noma ngazi imali yawo kodwa kufuze ukuthi abiza, but sithola thina siyobhekana ngqo nale covid singahlome ngalutho kanti nathi singabantu. Ngiyabonga kakhulu Bishop.
Thank you very much, Babu Komo. The last one for now is Pastor Maphumulo, and then I will give it to the HOD. Pastor Maphumulo.
Enkosi Tata, Baba Utobe. Thank you for the time. Greetings to everyone. Eyami nje yokuqala ile yokuthi what I've noticed indaba ye COVID kukhona abantu who are dying because they are feeling lonely esibhedlela. Abanye not because begula, but there are no people who are seeing them or visiting them. We understand what the COVID visit and all of that, but I think our government need to look at that. The people ababula stress, sokuthi ubaba uDubu sesibhedlele umkhwenyana wami angikwazi ukumbona i-depression iqale impilo yabo yakhe i-deteriorate. So I think ubaba uShabalala fanele ke sikubhekele ukuthi even though abantu bengabona what means can be done ukuthi abantu nje babe nama visit ey'bhedlela. And secondly, I'd like to raise the issue of information. I think ubaba wethu ubaba uDlomo has just raised that ukuthi nendaba yokufika kwe-information ne-media ingazi kuma-leaders iyoyena nto eyenza ibe ngathi ngesinye isikhathi ama-leaders ayaxambukela or abangathi afuna ukuthatha over. It's because i-information ayifiki kahle in right channels. I think I will plead to the Department of Health because you do have your management meeting, you do have all your HOD meetings, but escalate the information to relevant people so that the information is escalated kahle. Ingakho sizogcina sithola i-information kwi-media siyicall uma kuthiwa i-5G esibulalayo kube khona abantu abafaka ama-voice note ubone lo muntu athi I'm a scientist athi I sit in a command, this is what is happening. Really we have to believe that because those people are sitting in those meetings but we are not being given information on time, we are not being given information correctly, and we have people abanjengani Baba uDube. I think also I need to blame Nani. You are sitting there knowing these things, but when are they being downloaded to us as leaders? Sitshela ukuthi this is what is happening. So I think kukhona ama gray areas there and there ukuthi i-information inikezwa bani, but what I would like to plead from our government nokuthi athi amaXhosa kunganuka kubasiwe. Xa isinuka mayizi information correct singenziwa abantwana. Xa kuthiwa kukhona into enje mabeyazi, bring us together nithi hayi bafowethu sinimisleadile lana la nalaphayana, this is what is correct because nani ngabantu niyawenza ama mistake. Thank you very much, Bishop.
Thank you very much, Pastor Maphumulo. Ngicela ukuthi mhlawumbe nginikeze i-opportunity kubaba uShabalala obviously to take us through, and then maybe ngizozama nami ukubheka lokhu direct to us as pastors, especially people who sit in the legislature. Let me give an opportunity to you, Baba Shabalala, and respond.
Sibonge Bishop. Bishop angale ngale erizwe uyena uqobo Bishop eyama mortuaries and say, Bishop, in the public sector there are mortuaries that are there in the hospitals, and there are mortuaries that are there that we call the medical legal mortuaries. Uma ngenza umzekelo waseThekwini, we are talking of a mortuary efana nale yase Pinetown nale yase Phoenix. Those are medical legal mortuaries. Having touched on Phoenix, when we built Phoenix many years ago, we built it thinking of disasters that may befall the province and as such in the mortuaries. Now, when we are told to Guti, there are no spaces in our mortuaries, we must dispute it. Kodwa sibe sikuveza ukuthi i-problem esinayo is that we don't always want to go to the media and say, for instance, the person who went to the media and said, kunemzimbelele phansi RK Khan, I met him one-on-one and said, I see a glimpse in Belele pants. Up to today, we've never been able to see that. Up to today, he's never been able to tell me who said to him there were bodies that were lying down. But TRK Khan is one of the hospitals where after we moved out to see our corner, we've never rested because there are people who feel Uguti, we took a wrong decision, and the stability we are seeing in the hospital is a stability that says we took the correct decision. So as Zinizin go out to the media for reasons other than we see. Ukoni picture gayavela where somebody showed a picture yemizimba ebegwe on the side of what you would call a corridor.
Please unmute again. Yes.
Yeah,
please
unmute
again, Baba Ushabalala.
Yeah, unmute Baba Shabalala because yes.
Right.
Yeah, make sure you mute others.
Okay.
Initially, kwathiwa le mzimbe sasiyibone on a corridor ethile eyase Prince Mshiyeni. The same night, that day I slept at 2 because I had to give a response to the MECN minister to say which hospital is this. Only to find it's an American picture that was taken on the 20th of March 2020 in a truck in America. But people took it, basebethi bukana sena sena ndawo emamochuary ethu. Prince Mshiyeni kwashinjwa kwathiwa itinde. Ngavusa abantu and they checked, there was nothing like that. The question is, why do people behave like that? So we are saying mortuaries are getting high numbers of people, but we have not reached a stage where we cannot accommodate them. At eThekwini, another challenge we have is the burial space. I think Abefundis baseThekwini will remember that this is an old challenge that has been there. And I remember that 2 years ago, I was one of the people who said, probably we need to relook at the issue of cremation and pauper cremation in particular. And we need to discuss that. It cannot be a solely government decision because it speaks to the family, but also it speaks to the religion and the spirituality of different people. So it's a topic that we must delve into and say, how do we manage it? Not only at eThekwini, but all over. So in essence, Mfundis, we are having high numbers of people in our mortuaries, but we don't have a situation where we are saying we cannot accommodate them. The other part, closure of churches as compared to other closures, let me put it like that, because Umfundisi Mateus spoke of an example that you put. You may even look at businesses because he made an example here, saloon. We're saying, Mfundisi, in the resurgence plan that we are proposing, that we've proposed as officials, there is a lot of things that we think should be done. There is a lot of activity that needs to happen, but the non-pharmaceutical interventions are more important than the pharmaceutical interventions. The non-government interventions are more important. Uma siyile enkonzweni sifike sihlale sigcine u2 meters siyasanitize uma singena, but abazelwane uma bephuma, what do they do? How do they behave? Abafundisi basuke bengasekho lapho. It is why in one of the churches I saw something that worked, which was more like a drive-in church where they went in, Umfundisi waba nepodium washumayela, but it was more like a drive-in. So we are not saying isonto alibalekile ukushumayeza abantu nokuthandaza akubalekile, but we need to ensure that the behavior of our people has not changed enough such that uma bengabhekiwe they are going to behave and make sure ukuthi they are as careful as they are uma bebhekiwe. That is the challenge you are faced with. I-5G ngizoyithatha ngithi asiphinde siyicubungule siyibuyise kahle mfundisi. But I'm asking a question ethi iyiphi le theory that has linked a virus that has been found and a virus that in some laboratories has been grown so that research can be done on it? How do you link this virus with 5G? We don't have that information. We cannot dispute ukuthi hayi mhlawumbe khona information khona la kuhlangana khona, but akukho esikwaziyo okuhlanganisa the two. I did allude to Umthombeni ngesikhathi ethi we must consider the political worlds that we are dealing with as well. At some stage a few years ago, Huawei, the phone, was banned in America, not for any other reason except that it was developed in China. So there is this fight that is ongoing at that level, and one will not want to make himself a fundi on that. Safe to say that the medications that we've seen and have implemented on people as COVID-19 positive, we've seen it working without combining the COVID-19 with 5G. But I think 5G has come up so many times in this meeting such that we need to take it to our principals and say, communicate on this thing and ask the relevant people to pass the correct information that will link or delink the COVID-19 and the 5G. I think we need to do that. Does steaming help? Yes, steaming does help. What steaming does, remember, it's hot air that comes into your nostrils, hot air that comes into your larynx or the pharyngolaryngal space, and then goes into the bronchial space and also into the lungs if you inhale it correctly. And as it warms the inside of the lungs, the bronchi, the bronchioles, and the alveoli, yenza ukuthi mucus le ekhona ngaphakathi ibe more watery, kube lula ukuthi uyikhiphe uma usukhwehlela. That is why uma ustima, you must inhale slowly, ubambe umoya, but be careful because omunye umuntu uyithola sekhwehlela afterwards. Ngoba le sputum esuke sesilose, sisuke sesiphuma. And the technique of breathing is important. So it does help. What is important is where umuntu athi uma ungayifakanga i-eucalyptus ngeke kwenzeke. It's not true. Uma ungayifakanga i-Vicks ngeke kwenzeke. It's not true again. All you want is this warm air. Eucalyptus does enhance it and other things that people are advocating. But it doesn't mean without them it doesn't work. So it does help. But it doesn't mean use that and therefore hope that even your oxygen saturation levels are going to increase, because you may find there is this mucus, but also there is a pneumonia. That is why we say consult. We are looking at it in that fashion. Slow communication, angizukuspika Mpostoli Udlomo nabefundisi no Pastor Banya bakshilo kodwa the National Command Council communicates. The Provincial Command Council communicates. Every Sunday, the Premier is on media giving us the latest information about COVID-19 in our province. Every Friday at 1 o'clock, the MEC for Health Umama Nomagugu Smelane is on one KZN and other social media platforms and the community radio stations again communicating on the same thing. So there are those platforms that we are using, but it means they are not enough. And we have also decided to say the billboards that we've put before and have gone down, we have to take them up again. But the question is, if Abefundis are saying what is being said now, it is worrying because it says even Abefundis did not see what we had put on the media before, and I wonder why is it that it was not seen. So those are issues that we are looking at, but we are taking it and we are going to also try to make sure we revive our communication and our community engagement. But we also are saying these engagements, Mefundis, with yourselves are not aiming at giving you information just for you to have it. But we are aiming to say you've got influence, and therefore we are asking you to use your influence to go to the Amabadla Eninao or other communities and use this influence and pass the message, but more importantly, try to change the behavior of the people that you are dealing with such that they accept the new normal that we are faced with as a people. The other part that has come up is the issue of social distancing. We still are advocating it, and it speaks to what I've spoken about in the Abayokvulo. I will not go into it. Ngesikhathi iqala i-COVID-19, there were no beds that were ready for COVID-19. It came in and boom, we had to create beds. There was none. Now I have said we've got 3,657 beds that are ready. I did not speak to 954 field beds, that is the beds and the field hospitals that we already have. I did not speak of 455 beds that are in repurposed hospitals. So we do have the capacity and we continue to increase it as we see more people. Abanye uthola ukuthi it's because in the private sector and we have to, because what Ukuzeni said to us was, we are not responsible for the uninsured in the province. We are responsible for the 11.3 million people in the province, and therefore we must create space for all those people. And therefore we continue to increase space, but we also engage the private sector to say, if we then need to buy beds from them, we will do that from the private sector. But the number of beds we are having are very much close to 6,000 purely for COVID-19, and they are still available and we are still increasing them. So there are beds that we are creating, and even the capacity. Ukuzeni had given us an opportunity to employ about 8,000 more nurses, doctors, and other categories of staff. We employed them over 6 months. He has now given us 1.6 billion to add another period of time until the end of March in employing this staff. So the capacity is always looked at and we are increasing it. The worry about not churches, about congregation generally of communities, is the behavior of the people, not the churches, but the behavior of the people in general. Wherever they are, there is a tendency of removing masks, and we have seen it. That is the problem. It is not that the government is against the church. I think that is important. The issue of testing, we have now even said we want to have testing in the field areas. In Phoenix, there is a testing station. In Chatsworth, there is another one. We are continuing to get more of these. But it's not that everybody will be tested. We look at the symptoms and make the decision to test. And we are trying as hard as possible, Luguti, the test should be not more than 150, 170, where a person can pay. But also we are cognizant of the fact that some people cannot even pay, and therefore the test comes in for free. Again, government trying to reach out to the people. There are queues in clinics, but also we are having teams that go all over to families and homesteads and homes to go and test people there. That is why we are saying people rather say this is what is to be done. The issue of going to the churches, this is the, I don't know whether to say it, Bishop, church politics or what. We are currently dealing with abanye abathi bafuna ukuzokwakha ama-mosque ey'bhedlela, and we are stopping them. Now, uma amaKristu esethi no sifuna ukuzokwenza kanje thina ey'bhedlela, we then find ourselves having to try and balance, because we are in a secular state, trying to balance it ethi laba sibavimbile abafuna ukwakha baqale bethi no sifuna indawo yethu yokuthandaza sodwa, bese kuba bathi no sifuna ukwakha imosque la ngaphakathi, bese sibuza ukuthi uma kufika amaNazaretha ethi sifuna indawo yethu esobeka amatshe ethu lapha sithandaze. So we have that. It's a big challenge for us, and we're dealing with it on a day-to-day basis. But we are not saying people should not be allowed to pray. And I will follow up the Northdale story. PPE, no, we are not going to buy PPE for churches and for anybody for that matter. I think colleagues have seen what has happened at Gauteng, where people procured PPE and the MEC is gone, the HOT is gone, and also there are investigations even among us. La utoluguti PPE thing, you are following all processes, particularly namniga PPE, but did we follow processes? But all departments are buying PPE. However, what can be done given your other head and the other leadership that is here to say what can be done on this issue so that I do not respond wrongly. The information, I think one will be repeating himself. We need to really take it as a point of advice. Suguti, we are not visible enough, and we try to avail ourselves even more. There is information, guma messages, we chat, Pastor Komo, uti, queues in clinics and post offices collecting 350s are not properly monitored. Even churchgoers are safer as compared to the above alluded groups. When we discussed in the social cluster, we gave our people the option we are emaposin. We gave our people the option landi malzabo on different dates, eposini, but also Emma Bank, and people keep dismally refusing to go that they want their money, they want it in cash, they want to go to these queues. We have tried to correct it, and I think it's a mindset that we need to speak to. Mfundisi, may I stop at that? We take other questions if needs be. Thank you a lot, Mfundisi.
Thank you very much, Dr. Shabalala. I must say, one, on behalf of Abefundis, I know there might be one or two questions, but I do want to say on behalf of Abefundis, we do want to appreciate you, especially myself, because you are always available. I know that there is a list of other pastors who calls me and says, and we are available to assist them in our general hospitals, especially ngoba ngineqiniso kufanele bazi ukuthi awudili nama private hospitals. That's another problem ukuthi abantu abaningi they still believe ukuthi kufanele sema private hospitals. I truly believe Babu Shabalala, you have said it mouthfully ukuthi when a person etholakala ukuthi une COVID, indawo yakhe yokuqala kufanele akuyona ukuya esibhedlela. Isolation is very important. Nokwazi ukuthi yini okufanele ngiyenze when I'm being isolated. I must say this as a church, njengebandla, we also have missed the point, because when things like this are happening, when calamities are happening, we are the first one who need to stand up and jump. You know, one of the challenges ukuthi namhlanje we are critical of corruption eqhubekayo with government because the church has been quiet too long. We are the custodians. Thina njoba uhlangene nathi laba Shabalala, I believe ukuthi we speak to thousands of people who still listen to us. So that is why I believe ukuthi njengabefundisi sine role enkulu. This is the first initiated meeting with the people like Apostle Dlomo and Obabum Tembo and others. We need to unite ourselves and speak in one voice, because it's not going to help us again which answers a question yako babumyeni. One of the difficulties even as we speak today, uhulumeni esethe Agegu City Gozololo for 2 weeks, kukhona amabandla asaqhubeka. Abaqhubeki nabantu aba-50. Baqhubeka nabantu aba more than that. There is no social distance. On Sunday, I got a call ukuthi elinye lamabandla uma uya ngakoPitoli, I think bahlangene njengamanje lapho bahlangene kurawundi bagcwele, you know, it breaks my heart ukuthi there is no sanitizer, there is no mask. Ngoba abanye abefundisi, they literally say abantu abawakhumula ama-mask, they don't believe in that, but believe emthandazweni. That is why government had to act for us, esikhundleni ukuthi kube yithina esiyikhulumelayo, which was very, very, very unfortunate. So we think abantu abasenkonzweni akufanele siba risk. Kodwa mhlambe kubalekile ngoba uma amanye amabandla awanayo ngisho sanitizer, amanye amabandla awanayo distance yokuthi abantu bangahlangana babe u50. Abanye befundisi by nature abafuni kuyilalela into eshow uhulumeni noma ngabe ishow bani. It's a gospel truth, and that is why Pastor Sens and other ministers of the gospel, let us remove all these other things and begin to work together. Kuzosiza ngoba we've got a very big voice. Uma sisebenza ndawonye uthi uMphosolo uDlomo bakhona impela ababoshwe Vryheid beboshelwa lokho ngoba umthetho we level 3 uthi okwamanje asingahlangani, and upresident wayecele nje amasonto amabili kuphela, and the more singakwazi ukulalela, I do not know what is going to happen. We must understand and know our role. We are the people of influence. Leya ma PPEs cha ngicabanga ukuthi kuzofanele kwelinye ikapisi lethu sibheke ngempela ngoba they are seriously at risk. Ubabuzondi mhlambe bayophinde basize ngama protocols emngcwabo. Amasebe fundisi after each and every funeral. Uma kade kunomngcwabo this week, kuba noma umngcwabo the following week of the same family. Siya observe lokho ukuthi umuntu ufika tholakala ukuthi ushonile washona ngenxa ye-COVID emndenini. Kodwa abantu abakade besuke benaye 3 days ago, 4 days ago, aba-quarantinwa baba ingxenye yomngcwabo. Omunye wabazakhulume either ukhulumela umalume ukhulumela umzala ayosebenza the same mic umuntu okufanele ngabe uquarantiniwe. So I think babukhomo Mphosolo Khulekani, we need to relook at these things esisodwa bese senza ama recommendation ukuthi how do we protect our pastors, ngoba abefundisi abaningi abahamba nama mic basebenza the same mic ekade senziswa umuntu oshonelwe umuntu kade engaquarantinile behleli naye endlini akazange aye nokotesta. Kufanele sibheke nale ukuthi izosilimaza kangakanani. Ngicabanga ukuthi kodwa sizoyixoxa sesisodwa njengabefundisi, kodwa it is a challenge. Kukhona ama challenges amaningi. Kade ngilalela umngcwabo just today, abantu kuthiwa maniphuma lani ngahamba niyodla, kukhona ukudla ekhaya, and those are the dangerous things esi encounter. And ngibabalile there are more than 50, given ukuthi bayamthanda umuntu wabo, umlindelo akusafanele ube khona. Akufanele siyobona emzini omuntu samakhona sambe so 20 siya emzini omuntu ohlala endlini accommodate abantu abawu5 kuphela and siyobacinanisa asifake ama mic mase sishumayela ama mic I'm sorry ama mask sizowakhumula khona la endlini asithestiwe ukuthi isimo sethu ngicabanga ukuthi we need to build a force yethu thina sisodwa babuzondi babo umthembu nihlanganise njengabafundisi bapostoli ke siqhamuke nento eyodwa esizoyisa khulumeni ukuze singakhuluma ngama languages ahlukene ngicela ukuthi mhlambe sikubonge baba uShabalala angifuni ukuthi sithathe isikhathi esiningi sakho ubaba unathi zonke uzosenzela ivote of thanks kodwa ngiyacela befundisa ukuthi from now onwards let us connect and link with one another. Let us be our brother's keeper. We cannot allow to see ourselves dying the way we are dying. Ubaba uManyathi wenza ne recommendation enye meeting sihlangene baba ukhoma ohlanganise kuyona wathi thina abafundisi asebebadala asithi masishonelwa sicela abafundisi abasebasha njengoba buzondi ukuthi ngiyacela uhambe uyongimela kulowa mngcwabo abazalwane bakuvume lokho ukuthi babugwala uzoyongimela emngcwabeni ngoba at the moment akusona isikhathi sokuxegulisana ngabazalwane ibandla amalifa lifa lonke njengamanje khona amabandla avaliwe we must speak in one voice in one or the other we must help one another in one or the other kuningi mhlawumbe umuntu angakusho kodwa ke ngicela ukuthi bazalwane ngenxa ye data nangenxa yabafowethu abasizile basorganizela le meeting ukuze singabe sabhora uma khona eminye imibuzo sifuna ukuyibuza ngiyacela ukuthi siphinde siyithumele ukuze masicela babushabalala I address in the next meeting we are going to do that babushabalala ngithe even le ye 5G ayanele njengoba siyidiscussile sisazoyidiscussa futhi sisacela ukuthi nisilethele ama expert no professor abazositshela including odokotela abazositshela ukuthi bangaka abantu enibahlinzile esibhedlela nathola ukuthi problem kube yi5G you need to do that thina befundisi we are so gullible ngoba information sithola ku Facebook sithola ku WhatsApp sikhohlisana sisodwa and we are angry thina sisodwa you can imagine how much more intukuthelo ekubantu lapha ngaphandle abasidingayo kakhulu bonga kakhulu ngale information osinikeze yona we are going to write the questions we are going to still approach you ukuthi usize siyadinga kakhulu we are still going to say njoba ngeke ngasho meeting nethi communication yethu must be very visible njengoba sisuke ni
please unmute Bishop.
Yes, ba advertiser yonke indawo even ama billboard abo mhlawumbe ama billboard abo amanye ake sibone abantu abasha kuona sibone abefundisi kuma billboard bekhuluma kuma billboard ake sibone various people betshengisa ukuthi kunesifo esihlasele kodwa ke bazalwane asibe positive ekutheni we are not all going to die as long as sigcina ama protocols asupportena onesi bethu sisupport odokotela sisupport ama security let us be positive we are not all going to die ngamandla thize kaNkulunkulu we are going to continue to pray sizoyibamba imthandazo as much as imthandazo sibamba ama drive through sizowenza as much as uNkulunkulu esinikeza ithuba we are not going to stop ngoba ibandla kuthiwa sivaliwe we are going to continue to pray in our corners ngoba siyamkholela ukuthi uNkulunkulu unayo isolution baba ngicela ukuthi simnikeze ubaba uZondi mhlambe na uzoba nama comments bese we are formally usenzele vote of thanks baba uZondi Bishop.
Ungathi usephumile baba. He has been in and out. Yeah, he has been in and out. I think network.
Usawenza ikhofi ekitchen ukhulekani emgungundlovu hlalo wedamasa sicela ukuthi usenzele ivote of thanks usibongele Dr. Shabalala ngiyambona usebamba amafoni njengamanje okusho ukuthi sebeyamdinga kuma meeting alandelayo sizokudinga baba Shabalala baba ukhulekani
angibonge Mbuyazi Thuba osipha lona ngibingelele kubefundisi nawe kule ngosi namhlanje usiphe lolu lwazi osiphe lona. Ngicabanga ukuthi ke nawe uzwela ukuthi kubaluleke kangakanani ukuthi silokhu sithole information kuqala. Mhlawumbe my suggestion nje ukuthi uma kuhlanganwa kuma cluster lezi zinto enisuke nizidlulisa emphakathini ngoba akhona ama forums akhona eniwaziyo futhi mhlambe nizidlulisele nithumelele kuma offices ethu bese sidlulisela kubafundisi information ukuze bayithole kuqala mhlambe ingakabhebhetheki emphakathini. Ngalamazwi siyabonga kakhulu na next time ungaphela amandla dongela amavuso siphinde sibe kanye nawe. Sibonge befundisi bonke abadelay isikhathi sabo bangena kule meeting esiye saba nayo ukuthi sithole lolu lwazi. Siyabonga kakhulu. Sibonge ICC, sibonge babudube nawe ngokuthi uthatha isikhathi sakho uphakame ukuthi sihlanganeni sibe nalomhlangano. Siyabonga kakhulu. Inkosi yomusa inibusise inigcine inilondoloze egameni leDamasa. Siyabonga kakhulu ukuthi nime kanye nathi njengeDamasa. Siyabonga. Amen.
Siyabonga kakhulu Bishop Bukhomo. Ngifuna ukuthi bashawela before ushama zokugcina ngikhumbuza abefundisi ukuthi imhlangano enjengale sizoqhubeka nayo. Sicele baba uShabalala usisize ekutholeni abanye odokotela nososayensi, kodwa futhi ubaba umpostoli uDlomo i-Alliance of Pentecostal and Charismatic Churches ine meeting enjengale ye-Zoom engizocela ukuthi abayidingayo sizoyithumela futhi bazobe bekhuluma noprofessor uKholeka Mlisane, uchair of i-pathology laboratory subcommittees, uzobe address abefundisi. Former I'm sorry ngo 4 ngithi kusasa, kodwa ke information ikhona. Babudlomo siyabonga kakhulu. We are going to join you ukuzwa uvo luka dokotela uKholeka Mlisane nabanye odokotela bazosisiza. Mhlambe donga lamavuso kuzosisiza kakhulu ukuthi sibe nabaye odokotela abazosisiza ukuze singalwimpi ye5G. Kodwa siyakudinga kakhulu uhulumeni, siyamdinga. Asibambisaneni ukuze singashawa ngamatshe thina esibuye sisebenze kuhulumeni. Baba uShabalala, your last comments please.
Mfundisi, asibonge the opportunity to get to be advised by abefundisi, but also some of the things mhlambe singazenzi kahle to also be advised at that level. Sizoyithatha all that and take it back, but also as Mfundisi is closing, you're speaking of us getting more people or more specialized people to speak to issues. I think for us, Mfundisi, is to ask abefundisi ukuthi while they question some of the things, but can you be partners with the government and make sure that this new normal is embraced by our people? Ngizoyibeka nje icace, i-behavior yegenge yabantu abamnyama encane is one that is worrying more than the behavior of all other people. If you look at our video clips that we've seen, you will realize ukuthi genge yethu uma manje ungathi siyawavula wonke amabandla, probably they will be full. But uma ungathi uvula utshwala manje, you would be surprised ukuthi kunemizi engavalwa abantu beyifunela utshwala enile genge encane. The question is, what is this that has happened that has pushed our young towards utshwala? In fact, if one becomes political about this, at the end of the day, it is us who will be taking the very benefits of the fights that you've gone through, Babu Udube, and taking them back to Abelungu, because we'll just be concentrating on Utwala and concentrating on Ubumnandi. But yourselves, Babu Duma, Mbume, I think we must really make sense to the young, assisted by the church, to ensure Uguti, at the end of the day, the young is the future of our country. Let them delve into these things. Let them investigate these things. Let them then come with information crystallized. And then we go by that information and have a future as a country. Other than that, we will be having a very serious situation where we'll just be taking the country back to the white man. Ngiyangibonga kakhulu mfundisi.
Siyabonga kakhulu Dr. Dongola Mavuso. Baba Zondi ngixolisa kakhulu ngithe ngithi ngiyacela lapha kwasho ukuthi ubusaphumile uyokwenza ikhofi ekitchen. Thandaza Baba Zondi sivala imeeting yethu.
Mfundisi ubaba Zondi ulenzela umama akakwazi ukuzenzela.
Bishop Zondi uyezwa na? You are muted. Unmute and pray. You are muted, Babu Zondi.
Okay.
Please pray for us, Bab.
Can you hear me now?
Yes, we can hear you.
Angele hosting unmute. Bafundisi, thank you very much, Bishop.
Thank you.
Baba wethu ongcwele siyakubonga egameni elihle lenkosi yethu Jesu Kristu. Can you hear me, Bishop?
Yes, we can hear you, Mfundisi. Yes.
Hello?
Yes, we can hear you.
My line is bad. Can I ask somebody else?
Can we have anybody praying? Babu Clifford, are you there?
Yeah, boss.
Ngicela usithandazele baba.
Asikhuleke. Baba sibonga kakhulu Nkosi.
Uyangizwa manje?
Sibonga kakhulu umfa wakho.
Uyangizwa manje Bishop?
Ukuthi wena ube nathi. Iqala meeting wazwa manje. Baba ongcwele sibonga kakhulu nolwazi osiphe lona. Sibonga Nkosi ubuhle bakho. Kulesikhathi esinje Nkosi besidinga amazwi anje, besidinga Nkosi umhlandlela nedirection. Nkosi siyabonga ukuthi siyabona ukuthi kuyalunga. Sibonga isandla sakho, sibonga ukuhlakanipha okunikeza ingcebo zakho. Sibonga Nkosi ngezinceko zibekile ngaphambi kwethu, obabudube, Nkosi nodlomo, Nkosi nabanye. Sinika udumo kakhulu in the name of Jesus Christ. We thank you so much. Ibina obabushabalala, Nkosi siyabonga kakhulu ngaye. Udumo alibekwe Nkosi Jesu kuze phakade. Amen.
Amen. Siyabonga kakhulu befundisi. God bless you. Yeah. Sizohlangana kule ebizwa ubaba uDlomo kusasa. Sizoxoxa nodokotela. Madoda. Siyabonga dokotela. Siyabonga babuqaba. Thank you very much. Thank you very much, Doc. Thank you, Doc. Thank you. Thank you.
Babudube, ikubusi Nkosi baba.
Siyabonga. Thank you Baba Mthembu. Thank you Pastor.
Siyabonga mfundisi.
Akubo umusa.
Amen.
Baba Tax. It's good to see you. Good to see you. Bishop. Thank you.
Asibonge Bishop, sibonge kakhulu
Siyabonga mkazi. Uyigadi sobantu leyo. Eyami. Yes, my leader.
Kunjalo. Siyabonga.
Ungikhumbuzela umfundisi uTrevor.
Mfundisi uTrevor mawuqeda la kuzofanele ufonele uhlalo wethu eKra. Baba uMpostoli uZungu, Baba Frederick Zungu, thank you very much, Baba.
Thank you, Baba. Thank you, Bishop. Thank you, Bishop. God bless you, Baba.
Bless you, man of God. Siyabonga kakhulu propheticals. Thank you very much. Baba Phumlani Ngcobo.
Asibonge nathi khona umuntu okaZungu manzini.
Amen. Amen. Amen.